Going to start the recording. And today we have two questions that we are going to go over, and these are going to be formative questions. And I want participation as much as possible. And that is the only way by which we all are learning. And this is your chance to just develop a little bit more confidence in your answers that you have prepared already. So the first question that we will go through is, tell me about yourself, right? That's the first question. And there could be various ways by which they could be asking this question. Before that, let me just step back a little bit. There's always um, people have two minds on this, whether you should talk about your medical background or you should mention about your non-medical background. It's everybody's guess, but I believe you should mention a bit or two, one or two lines about your medical background, and then home in much more detail about your non-medical aspects. So, and I would try to, present to you from my standpoint an answer similar to that. So you connect your medical background with your extracurricular activities, etc. And what I would also suggest is always listen to the question. They may be wanting to ask about your medical background, right? Then make sure you mention your medical background a bit more. For example, if they ask you, so tell me about yourself, right? So, it's up to you what you want to do with that question. You can start with the medical first two lines and go non-medical. They may ask, okay, great to have you here. Can you walk me through your eras? Can you walk me through your CV? Now that's a different question. Now, when they ask you about, hey, can you walk me through your CV? You're going to talk about your medical background as well as your non-medical non-medical aspects. So just be careful about what they're asking, and that's why you need to practice. You need to practice lots of questions so that you are comfortable with answering any type of question. Okay, they could ask, so can you give me a 1-minute introduction of yourself? So that's something else. So they can also, hey, connect the dots of your path so far, right? Let's say another way they can ask is, so what's your story, Dr. Stephen? What's your story, right? What's the headline of your journey? What's the first paragraph, right? So what's your origin story in medicine? Okay, so there are different ways by which they can go about asking questions. All right, asking these and any of these questions. The most commonly, tell me about yourself. So what brings you here? So just be mindful of that. And then what I usually like to do is I like to provide a transitional sentence before I answer a question. But I want you to practice your questions and answers before you practice a transitional question, a transitional statement. So let's say, for example, they mention that, okay, tell me about yourself. You say, well, I love to definitely talk about my background, especially some experiences that I've had that have actually shaped myself beyond my medical training. But to mention, and I would not like to jump deeply into my CV because you definitely also would have that. I do have a very high score in my step 2, and you can see my notable research experiences. So just to highlight a little bit about my medical background, but I would like to tell you a bit more of what led me here. I did grow up on a small farm in a small village, and that may seem unusual for a doctor, but it did teach me a hands-on approach to life early on, I would think. Whether it is helping out with the crops or learning how to fix a broken tractor, trust me, I've been there, I've done that, and I know how important it is to get your hands dirty. So we didn't really have a typical day at work. Everything could be the next day could be different from the previous day. So that was my early upbringing. But moving on, I've developed an interest of making models out of toothpicks, and I'll show you my different ships and airplanes that I actually constructed out of toothpicks. Yes, that was a very daunting and painstaking activity, but I believe that has served me well. So after the end of the day, I normally like to unwind by reading a storybook. And I've recently been into Sidney Sheldon's novels. In medical school, I had the pleasure of leading a small group where we were part of a blood products, blood bank, where we worked with the blood bank. And with the blood bank, what we did was we looked to help deserving patients procure their blood products for whatever reason they're unable to afford or manage blood on their own. And back where I come from, we don't have an efficient blood delivery system. So this was a quagmire in itself. I would love to share some of the stories that I've had to go through. And also in medical school, I also led a group during my clinical years in medical school where we taught each other, what do you call it? We taught each other clinical skills. And I do believe that because of that experience, I used to perform really well in my final examinations. So just to bring it all together, with my background working on a farm and my medical expertise as such, I am thrilled to start this next chapter. And I'm looking forward to building new experiences and skills in residency and be a resident that you can count on. Thank you so much. If you have any questions, please feel free. Thank you. Okay, so I'm just regurgitating a few things. And one thing I would want you to note is don't act as if it's memorized, be casual. It's okay to stumble a little bit. Be yourself, be normal, but have it prepared. So that's the thing. You prepare enough that you act natural and you act normal. Okay. So
Dr. Khan, I have a question. What should be the ideal length of this answer? Like how many minutes it should be?
So this is an opening, and this can be longer. This can be a little longer. It's okay. I think the first question can be a little longer. It's okay.
Okay.
And 60 seconds to 90 seconds, that's what you should be aiming for.
Thank you.
All right. All right. So let's have it, guys. I need somebody to step up. And even if you haven't practiced before, this is your chance to practice. The only way we will learn is if you practice. Who wants to give it a try? Or you can read off your paper that you have. If you have put together up some answers and questions or use some of the templates, you can just read through it. I don't need you to be too proficient, but really get to the bottom of these sessions, or get the most out of these sessions. You have to practice a little bit. Who wants to give it a try? Abdul Manan, talk about yourself.
Yeah, I would love to answer this question. So I have not rehearsed it earlier, but I will try to.
You can, if you have it written down somewhere, just read that. It's okay. It's not a big deal.
Yeah, just give me a moment. I am trying to find the answer.
Sure, yeah, that's fine. And others can also find their answer, or just jot it down, make it bullet points, what they want to talk about, or see what they want to say.
Okay, so I'm going to answer now. So thank you for asking. I'd be happy to share about myself. I'll start with a bit of my background and including some of the unexpected moments that have brought me here. So my name is Mohammad Abdul Manan Mangral, and I'm from Islamabad, Pakistan. And I'm currently working as an extern at St. Elizabeth's Hospital in Washington, D.C. Coming from a non-medical family with two engineering-oriented sisters, I chose to carve my own path. And along the way, I found psychiatry. What made psychiatry appealing to me as a student was the opportunity to contribute even as a learner, even as a student. And from those early days as a student, as an observer, to now being a participant as a part of multidisciplinary team, this journey has made me value the field even more deeply every single day. I feel fortunate to be associated with psychiatry. My academic journey and my USMLE scores speak a lot about the academic achievements that I have achieved along the way. But for me, psychiatry has been always more than the academic grades. For me, this is about the opportunity it offers me, about the human connection and the privilege of being part of someone's story. Apart from academics, I was also one of the founding members of the first ever institutionally recognized music club in my med school. I also love calligraphy and traveling, and the past months of the US clinical experience have been rewarding in terms of traveling. And now, as I move into residency, I'm excited to bring my background, curiosity, and empathy into the program where I can continue learning, not just about the disorder, but also about the people. Thank you.
Great, Dr. Manan. Do you have any, can you talk about a patient experience in psychiatry that really moved you?
So first of all, when I was a student back in the med school, so as a student, we were supposed to observe the patients. We were not the part of the treatment team, but there was this patient during my rotation who was depressed. She could not speak, and she was. But what I did, like I offered her a space that she could just speak her heart out, and I offered her the environment, the safe space that she could tell me all her emotions. And then I felt that even as a listener, I could contribute a lot to the patient interview.
Great. Okay. So the reason I had a follow-up question, they may ask you a follow-up question about what you said, right?
Yeah.
So, and especially in psych, they really want to know if the person is really suited for psych.
Yeah.
Psych is a special specialty which I don't think I could go into. So they will ask you questions. They will ask you more personal questions. They will ask you more your interpersonal skills, how to handle conflicts, how to deal with unruly patients, which
Yes.
you will deal with in psychiatry a lot more than probably other backgrounds and specialties. So yeah, just be ready for that. And yeah, in the coming sessions, we'll talk a bit more about that as well. All right, who's next? Wants to go? Guys, it's just a conversation. If you have anything prepared, written down, if you don't have anything prepared, just it's okay. You can just talk about things.
I can go if you like.
If you like, we can go.
Yeah, okay. So it's just a little bit I'm working on. Okay. So I would love to take you to my life, and let me start with my name. My name is Adina, which is an Arabic origin, which has an Arabic origin. It means someone who lives in paradise. And I know I will tell you in a while why I mention it here. So I grew up in a small town in Pakistan, and but I have big dreams. So that helped me pursue my medical journey in one of the largest city in Pakistan. But the dreams didn't stop there. Uh, I cultivated the motivation to go into the US and pursue my medical journey there. So I worked hard and I studied for my USMLEs. And I get here. I did my US clinical experience. It was very warm and welcoming. So it was one of the greatest experience of my life. I really was able to appreciate the contrast between working in a very developed country and from where I came from. It was a bit exceptional. So this is from my medical perspective, and if I take you to my personal life, I am a very social animal. I love to hang out with my friends, and I love to explore new cities, new culture, new cuisines, and I also am a big fan of theater and arts. I like to express myself through theater and art, and it taught me a lot. Actually, it honed my leadership skills when I directed a movie in my during my final year medical school, and it also taught me improvisation and creativity, which I believe is one of the greatest skills to have when dealing with high pressure situation in medicine. But with all these blessings and with all these blessings and things I have in my life, I feel very grateful. And sometimes I do think that it has something to do with my name, because I do believe I live in paradise when I see all these things. I hope you like my answer. If you have any more questions, please feel free to ask. Thank you.
All right, great. So you have a very positive outlook of life.
Yeah, for the program, yes.
So that was an opportunity. You could have, if somebody says that, you could say, oh, yes, definitely. I think life is what you make out of it. And I'm always looking forward to creating the best for myself and for my family, friends, and taking everybody along.
Yeah.
So you just expand on it, be more conversational.
Yeah.
So the next lesson, I think, what is it?
Why do you think that you're a good candidate for the program? Was that a question?
No. So I asked you a follow-up question. So you think life is a blessing or something?
Oh yeah, yeah.
So I think you just gave me a very short answer. So I gave you an example of what you could have said.
Yeah.
You could have been more expressive. You could have,
Yeah, I understand. I
right?
understand. Yes.
So I think the next session we have, I think tomorrow, is confidence and general conversations. So of course, we all come from backgrounds that we don't have, we don't converse in English openly or in normal language. So that's very important to be able to come back and respond is in a general way. Whatever you're thinking in your language, you think in English, and you just talk about it, right? So good. All right, who's next? And one more thing. So that's one reason we have to practice. I think when you opened up, you said, I will go to my life or something similar. So you need to make sure your answers, especially the prepared answers, have proper grammar. So
Yeah.
I want to walk you through my life. I want to give you a snapshot.
Yeah.
So
I got a little nervous and I
yeah,
messed up.
we're only here just to practice.
Yeah.
So that's it. Who's next?
I can go next.
All right, Dr. Osman.
Okay. Well, thank you so much, Dr. Khan, for giving me the opportunity. Well, I'm Dr. Muhammad Usman. I was born and raised in a very small village of Pakistan near the Sialkot city, where I completed my high school, and then I moved to city Lahore, where I completed my medical school and intern year at Allama Iqbal Medical College, which is one of the top post medical schools in Pakistan. And after completing my med school and USML exams, I then moved to US, where I completed almost about 8 months of US clinical experience. And I really enjoyed working in team and learning about like the electronic medical record systems and various innovative protocol-driven management being done in the US, and which like further enhance my understanding and my motivation to pursue medicine in the US. And apart from my academics, let me say that I come from a farming family. I have been helping my father and my uncles in gardening and farming. And from this, I learned the value of hard work, patience, and attention to detail, which I bring in my approach to patient care. And also, I am a big foodie. I love spending time with my family and friends, and I often cook for them. And I think these are some of the ways which also help me to keep balanced and in my personal and professional life. And moving forward, I'm excited about the opportunity to train in internal medicine where I can grow both personally and professionally. Thank you, Dr. Khan.
Great. Tell me a bit more about your farming experience. What did you used to grow?
Well, uh, basically, I'm from a small village named Nathukler in Sialkot city of Pakistan, and we own various farms. Basically, we grow mainly two crops, wheat and rice crops. Apart from that, like these are over the year, there are two seasons of crops, and I used to, in my early years, I used to help my father with that. And apart from that, I also do some gardenings. I have grown two plum trees in my garden and various other like vegetables and fruits things. And these are like I used to help him over in my early years. But once my medical school started, I got busy in my studies, and like after that, I like whenever I have some free time, then I like go there and help them and enjoy my like because it's in my nature, I often enjoy my doing those things.
Okay, great. All right. So just a little bit of feedback. So I think all of us, we need to work on our pronunciation. So the first time you said farming, it sounded, I couldn't really understand it the first time you said farming. So just open your mouth. Open your mouth. I mean, I have trouble because I have braces. Always these things stick, my gums stick. But learn to, always have like a glass of water, safe to keep your mouth moist, so you can open up your mouth, right?
Right.
Then you said approach to patient care. I understood what you were saying, but you did not say approach. You said something different, which did not sound like approach. So I think you can just work on your pronunciation. Open your mouth,
Right.
practice, stretch out your mouth. It's okay. Stretch out your mouth. Use it. Do whatever you can. Just stretch out your mouth. And I know that's a big issue sometimes, but stretch out your mouth. Scream loudly in English. Okay. I know you can probably
Right.
speak loudly in Punjabi or some other language, but speak loudly in English to get your expressions and get your clarity of your speech in check, right?
Right.
Okay, good. Who wants to go
Thank you,
next?
Dr. Khan, for feedback.
I can go next if it's okay.
All right, sure.
Can you see me,
Yes.
doctor? Okay. So I just made a template. If you could give me some feedback, that'd be great. So thank you for giving me the opportunity to introduce myself and give some of the experiences that informed my decision to pursue medicine. I actually come from a very unique background because of my father's job. I actually grew up in 4 different countries, very different countries at that, from Saudi Arabia, Dubai, and then somewhere in London, and then I went back to Pakistan for my medical education. And I realized growing up that I have roots and stories that shaped my experiences and ultimately informed why I wanted to do medicine because of the different cultural experiences I had growing up. And these experiences actually helped me exposed to different clinical settings. For example, I volunteered at the age of 16 at my local hospital in the UK as part of the nurse team, which taught me how to interact with patient, how to set professional boundaries, and understand protocols. And then when I was in Pakistan, as part of my medical rotations, I worked with the underserved population. And what that taught me was that I needed to assess the healthcare literacy of the people there and how I can adapt my communication skills to fit their understanding. So these experiences have really taught me on how culture is really important in being a good physician. I have had the opportunity to carry out research. For example, I was actually the founder of Society of Internal Medicine and Research at my college, and we carried out some workshops on manuscript writing and topic selection. And I think these experiences helped me to improve as a researcher, which ultimately helped me get some publications and a poster presentation at global embolization of the conference called Global Embolization and Symposium of Technology. outside of my education and research, I take a particular interest in art. I think art is a great refuge for me to express myself and also also culturally connect to other artists around the world and see life from their perspective. And overall, I think what I'm excited for in the future is not only becoming a good physician, but also becoming a good caregiver where I can not only diagnose and manage well, but also work with patients and walk with them on their healthcare journey. Thank you.
Great. So yeah, that's now good that you had the camera on. So a few pieces of feedback for you. So very good overall. One thing I would want to, as you practice looking at the camera. So my computer is here, so that's why I may look over here and my notes are here. But when I look to talk, I would talk like right into the camera, right? So that's very good. You will work on it, so that's fine. Second, so make the camera a little distant from your face. Yeah, make it a little farther away. So it doesn't seem as if like you really right up close. So you just work on yours. Let me see how I am looking. Let me see.
Yeah, I actually can't see how I look right now, so let me.
Right. Yeah, it's okay. But like right now, just practice later on. Right now, when you lean forwards, you're like really into it. I don't know how.
Okay.
Yeah, very good. So, all right. So, what was your research article about that you presented at this conference?
So it was actually a poster presentation, and it was about the use of cryoablation in lung tumors for patients that cannot go through surgery. And I think this was a great topic because we have a lot of patients who are mostly towards the older age of the spectrum. So like people in their 80s or people in their 70s, mostly with comorbidities like cardiovascular diseases, and they cannot go through surgery. So I think the poster was, so the topic was about exploring alternative techniques we could use to operate or not operate to, for palliative care and also to relieve these patients of their disease burden.
Okay, great. So what was your study design for this? Seems very involved. What was your study design with this?
So it was actually a review. It was not as such, because we were actually limited in resources, we couldn't actually carry out a full-scale clinical trial, but this is definitely something that I want to do in the future if I get the opportunity to. And definitely at a program which supports research protocols and research methodology and mentorship, I think I can actually do this and carry this project forward.
Okay, so I'm of the view that you always talk positive. So, and you were very strong at the end when you said, "I'm looking forward to working on this further," and you would find me a very active participant in any research activity at your program. You would find me to be an active participant in any research activity at your program or research day, etc., etc. You could be proud and say, yes, well, this was a review project. This was a review article, and and this was a great experience for myself, where I went over all of PubMed. I found different ways to explore different aspects, use different keywords, use different filters. That really got me up to speed by which how PubMed can be used as an excellent tool for research purposes. So just come out
expand
really
on what I did.
Just expand on what you did. Be really, I mean, of course, you know what you did. I'm just guessing what you did, and be very positive in the way that you bring it. Don't say, oh, we have limited resources and all that. That's fine, but just be positive what you did. And right. So they may ask you, did you include? What type of review did you include? What was your inclusion criteria for papers of articles? What was your inclusion criteria, exclusion criteria? So they may ask you. So just make sure that you know things about that, right?
Yes. Yes,
okay.
Yes, definitely. Thank you, doctor.
All right, excellent. Who's next? Anybody
Can
wants
I
to?
go next?
Sure.
Oh,
It's your field. The field is open.
all right. My name is Asma Mahmood. I grew up in Pakistan with a family of 10 people.
10
Uh,
people.
we, yeah,
What?
I
Okay,
had a
I want to
huge
hear this.
family.
I want to hear this. Okay.
Basically, we were 6 siblings, and our grandparents also lived with us, so we are all 10 people.
Okay. Okay. Now I can relax a little bit. Okay. All right.
Being the first daughter, I became the person who I was the person who automatically became the confidant for my younger brothers and secret keeper for my elder sisters. I feel like this role has prepared me more than anything to be a compassionate listener and problem solver. Even in my current job as the director of Scribe Company, I am the chaos coordinator managing my team and solving all the issues. When I'm not solving problems, I cook new recipes with my own desi blend. If I were to make videos and upload it on the internet, people will definitely come for me. So I don't do that. Since I'm a big foodie, I kind of have to like exercising as well. I'm working on strength training these days. Apart from all these, I love animals, and my husband and I have been having this ongoing debate for 3 years that whether we need a cat or a dog first. I think I'm really close to convincing him that we should definitely get a cat as they are a bit low maintenance and we should start from there. I'm having some trouble ending how should I end my tell me about yourself statement.
No, you just sum it up. I'm here. I'm positive. I'm looking. So I'm trying to act as if I was you because you came out very positive, very sharing that people may be sometimes reluctant. So yours will be a very not a casual, but again a positive approach to any of this. And it just says, yeah, I'm a positive person, and I will look to bring all of this positivity, including my medical experiences and my experiences. If you have any clinical experience, my experience with this, and my friendly behavior and attitude to any program. And I'd love to be here. And please feel free to ask me any questions.
Okay, all right, that makes
So
sense.
just be
Thank you.
positive. Go with the flow of your delivery. Yeah, you're good. So I think your framing of the video is a little better. You can, yes, you can still be a little bit back so that when you're showing your expression with your hands, you could do that. And
Okay.
sometimes we have a tendency to just come up, right? So this will avoid. If you do come up too close, that's fine, but it shouldn't be too close. So if you're already sitting a little bit back, then you won't risk it, being your nose in the screen. So that's good. So you're stay a little bit back. That's good. Then again, just work a little bit on your grammar. That's it. When you write it down a little bit more, just go through a little bit of grammar, because I think when you mentioned when you start to talk about a scribe company, right? So there was a little bit of grammatical issues over there. So just work on that. They can, so that also was a very positive a thing that they could ask questions about. Okay, scribes, what do you do with that scribe company? Is that, do you also take part in it, or are you actually involved in the management of that company? What do you do?
I'm being a director, I'm onboarding new team members, training them, and I also have a doctor that I work with. So I'm actively involved in scribing as well. And I prefer to do that because any changes that are coming up in the EMRs that we're using, I am well aware of it. So I can transcribe that. I can use that in my training for the next people.
Great. Which
Next new team.
EMR have you had experience with?
It's point click care. There are multiple EMRs that I have been using. It's point click care, which is basically used for the skilled nursing facilities. I have also had experience with Epic, but I would say I had less experience with Epic as compared to PCC,
Okay.
point click care.
I'm only asking because expect follow-up questions, and I jumped in the middle. 10, they could interject you right in the middle of your answer. Okay. All right. So I think you have to move on to the second question, because that is a very important question as well, and we're running out of time today. So what was our second question? I forgot. Okay, yeah, the second question was, why should we choose you? So these two are the questions that I want you to take an extra bit of time on these two questions, because these are important questions. One, to open up the field, and second is that why should we pick you? So there are a number of ways by which they could ask this question. Let's say for one is very simple. Why should we choose you over other applicants? What sets you apart? What makes you a strong pick for this program? Okay. So they can come at from different angles. And yeah, so you have to be ready for this question as well. And this, again, in this, you have to show a little bit spine, but at the same time, be casual in the sense that you're not belittling anybody else. And the way I would look to approach it, always have a bit of a transition sentence. I'm not sure if you looked at the first lesson about Tell Me Myself in the program. I have a module in it where I talk about transition sentences. So make sure you guys look at that. Transition sentences is very sometimes a good way to communicate. So you can pretty much say, that's a great question, and I don't really want to belittle anybody else, but since you have asked, heck, why not? Let me just talk about myself a little bit more, why I do believe I'm a strong candidate. I'm a strong choice because I pair, that's how you will start answering. And then you can talk about your background, your experiences, how good of a candidate you are, your research experience. And yes, I bring all of this to the table. And that makes me an exceptional candidate, which I do say so myself. Although, again, I do not want to belittle anybody else. And I do know there are very hardworking and deserving candidates out there. But thanks for asking. And if you have any particular question, please feel free to go ahead with the question. So these two questions are very important, and you have to be ready with this question. All right. So I want you guys to practice. We have a couple of minutes today that we really should work on this. Why should I choose you? Okay, so hey, doc, you're here, but I have 20 other doctors who are equally as qualified. What sets you apart? Anybody wants to go?
I have a question.
Sure.
Can we use this sentence for answering this question that, so I believe all of the candidates are very exceptional, but I would like to tell you why I am better than them, and then we go about it. Is it a good opening
Yeah, that's
line?
a transition. That's a good transition.
Okay. Okay. So, okay, I'll try answering this question with this. So I believe every candidate here is exceptional, but I believe I can communicate that I'm better than all of them by saying that I master some of the skills that sets me apart. One of them I particularly want to mention is my leadership skills. I have the chance to lead one of the Pakistan's largest research epidemiological study that has been sponsored by Al Khan University, but I was the lead in Lahore, in one of the institutes in Lahore that is called Punjab Institute of Neurosciences. I oversaw a lot of candidates, a lot of interns there, and I led the project, and that helped me cultivate a lot of, problem solving skills and critical thinking. Despite of that, I think I am very exceptional in resource management, and one of the example is when I volunteer for the recent flood that that ruined a lot of people and a lot of that were in a lot of areas in Pakistan. We had struck with one of the worst flood this year, and I managed one of the camps, a medical camp in one of the rural areas, and we were very resource limited. We had very few medications available, and we have to prioritize what needs our attention most. And I think those are the skills I think I cultivated in myself, which sets me apart from rest of the candidates. Thank you.
Okay, great. Good start. I just want you to, this is just a first, right? I agree with that. Just want you to refine your delivery. And one word you said a few times, I mean, 2 words, so just refine that out of your, speech.
Yeah, okay.
And that's it. Just work on the grammar, and I think that's good. The work on your delivery, you make it sound more casual, more approachable.
Okay.
It's very good.
Okay.
Home in on some strong points. Home in on some strong points. Very good. Anybody else?
Can I answer for this?
Sure. So, Dr. Manan, glad you're here, but I have lots of candidates with stellar scores here. Why should I choose you?
So I genuinely believe that everyone who has reached this stage is hardworking and deserving. But what I think sets me apart is just not my academic background, but my ability to lead and take initiative, and not only taking the initiative, but also assuring that I complete the task. During my med school, as I already mentioned, I helped found the Iqbalian Music Society, which was the first ever institutionally recognized music club in my university. And that experience taught me how to bring people together and build something on from the ground and follow through on a shared vision, qualities that I have carried with me into the clinical work. And apart from that, I'm pleased to share that although I am dedicated and I aspire to be a hardworking resident, but something else that I definitely bring with me is a humanistic approach, a team-oriented strategy to the program, and as someone who will not only contribute academically, but also to interpersonally to the culture of learning and care. Thank you.
Great. Yeah, it's you can definitely bring in something more in there also. You say, hey, not just my grade scores or my research experience. I have all these other additional experiences that I will be bringing in to any program. So yeah, hit all of your strong points. If you have a strong point, just hit it. One thing I would like to suggest is work on your, again, pronunciation and opening your mouth. Just work on it. The more you work on it, the more you do this, the more you practice, the better you will get. Very good. Very good. Who's next? Salman said that he wants to go. Okay, Salman, you can come up.
Hi.
Unmute yourself.
Thank you. Sorry about the background. I just woke up and
it's okay. I did the night shift.
Okay.
It's 12 midnight for me right now.
Really?
No. I did the night shift, so I'm in the US, so
okay.
I'm not sure where you are right now, but
I'm in the US as well. Okay, I understand.
Great.
I understand.
All right. So what do you have?
So the question to why me, or what do you want me to answer?
Dr. Salman,
yeah.
So what sets you apart? What makes you unique? What is that you will bring to this program?
I think what sets me apart the most, that I believe that you guys should consider ranking me, is the fact, one, I do have clinical experience from back home. I did my internship. Two, I proved myself academically by having good scores. Three, I believe that I can perform well in an academic setting. I demonstrated leadership qualities during my time as the class representative. I led my class through multiple academic things like COVID, and made sure they had access to their lectures, and arranged different things for them. And that's what I believe really led me into a kind of public person that can deal with people, that can deal with faculty, peers. And these qualities, I believe, have made me into the person I am today. And I think one thing that sets me apart from all these experiences is the ability to keep on growing and learning. That's something that I believe. For example, I had a kind of lower end. I didn't have great scores in my mid school, but when I hit the USMLE, I wanted to improve myself. I wanted to learn day and night, and I proved that with my scores. As an example. So that's why I believe you should rank me, and I guess that's about it.
Okay, very good. So you hit all the points. I think you're probably on a phone right now, correct?
Yeah, I am.
Okay.
So that's why
Yeah, that's fine. Yeah. So when you're on a laptop or something else, or a setup, make sure it's eye height and everything else. Yeah, just very good. I know this sounded a bit impromptu, but that's fine. That's what we're here for.
Yeah.
Just practice a bit more, make it more, and make the delivery come out natural, which you were. Make sure whenever you practice, it does come out natural at the same time, right?
Natural means more practiced, or kind
So
of
practice, you practice you being natural.
okay.
If you know what you're going to say, you will be natural. Just don't just look in front of a computer on a mirror or a window, anything.
Okay.
Record yourself, repeat it, record yourself. Go on Zoom. You can easily record yourself on Zoom and play it again. See if you're looking like a normal person. If you're talking like a normal person.
Okay.
Right? Just casual, you're having a conversation. Okay.
Thank you.
Right.
Thank
Very
you for
good.
that.
Who's next?
I have a question quickly. If I wanted to ask if we mentioned some of our key skills in the tell me about yourself question, and then they ask, well, why should we choose you? Can we repeat some of those? Like, for example, if I talk about my exposure to different cultures, or if I talk about starting a society at college, can I repeat that in the second part by giving example as to why that makes me a better candidate for this program?
So yeah, you can talk about your cultural competency. You can definitely talk about. So in this question, they are looking for a job prospect. So you are telling them you can do the job. So one viewpoint to look at is they want to hire somebody who is going to be a good resident, right? They are looking to hire someone who is going to be a good resident. It's going to be a training program, but they actually want you to work. So you will tell them why I'm ready for the job, right? So these residency interviews, we tend to look at it differently, but these are just job interviews. This is just a job interview, and you're looking to sell yourself.
Right.
So
yeah, so what I'm getting is that you can repeat them as long as you present yourself in a favorable manner.
Yes, and in this answer, you will talk about your academics, your research a bit more. You will talk about your academics, your research, what will make you the best resident, a confident resident. I will hit last. Salman said that he already has clinical experience in his already has a clinical background. I will hit the ground running. I will hit the ground running. I already have experience with EMRs in the US. I know your EMR might be a little different, perhaps, but it won't be a big of a hurdle for myself because I am well aware of the different aspects and how to run an EMR. Or back home, we also had an EMR, although possibly not as robust as you may have over here. But I think I will be hitting the ground running.
Okay.
So this, you are like a candidate. This is your job question. Your way to shine, and you can be long in these two questions. You can be long in these two questions.
Okay. Is it okay if I try this question?
Sure.
Okay. Just a disclaimer, I am doing this right now. Like, I didn't prepare for this one, so it might be super. Okay, so I think everyone here is a deserving candidate, but I think what sets me apart from everybody else is that I have been incredibly fortunate to have an exposure to all of these clinical settings in different cultural, with the different cultural backgrounds in mind. And that has improved my cultural sensitivity and widen my perspective as to how we should deliver patient care, depending on the type of person we encounter. And I think that is incredibly important in the US because of the different types of people from all walks of life that we encounter at different hospital systems. Another thing that sets me apart is that I have had direct experience leading a team and working with different team members. Starting a society at college was definitely a demanding experience, but I think it taught me a lot about how I can lead better, but also I learned from everybody else on how I can be more flexible, how I can improve team meetings and listen to everyone's feedback to improve an organization in general. So I think I've had that direct experience in leading a group project, but also working with different team members to improve the quality of the project. And lastly, I think what sets me apart is my ability to empathize with the patient. As I said, I've had experiences working with underserved population, both in Pakistan and in the US. And what I've realized is that sometimes, we take health for a privilege, and encountering patients from different backgrounds, sometimes from low socioeconomic backgrounds, I realized the obstacles they face in their daily life in terms of their jobs, their diet, and health. And I think that has really improved my ability to empathize and tailor recommendation according to their lifestyle. And hence why I feel like these qualities that I have cultivated and strengthened through my experiences make me a strong candidate at your program and someone who will be a good fit for your program as a resident.
Okay, great. All right, yeah, that's it. So again, you will practice more and it will become even better. Great.
Okay, is there anything else I should work on?
No, I think it's a good start. It's definitely a good start.
Okay.
All right.
Okay, thank you so much.
All right, we got one last person. Who wants to go? Who wants to be the last?
I can go.
Okay, all right, go ahead. All right, so,
Okay,
so
well,
Salman, so yeah, I'm looking at your CV and I do have a lot of other similar candidates. What brings you to the table? What do you bring to the table?
well, Dr. Khan, in my opinion, everyone has its own strengths and weaknesses, and I'm sure that all the candidates must be very good in their clinical and other things. And some of the things I would like to mention, which I think set me apart from others, is that like one of them, that thing which has helped me over time is my ability to resonate well with the people, which makes me a good team player. I have been a vice president of quiz society of my medical school, where I like led and arranged various quiz competitions along with my team, which really like helped me develop the teamwork and leadership qualities. And secondly, I would like to mention that my journey from a very small village to bigger city Lahore, and from there to US for my clinical rotations has given me the consistency and perseverance, which I think has really helped me along on the way. And from like interacting with patients from different cultural backgrounds really helped me to communicate with them, especially during my intern year and then my job as medical officer in my home country and also in the US during my clinical rotations. And one more thing I would like to mention that I am very passionate about the things I want to do. I am always eager to go extra mile to learn and grow, and like I like to like grow with other team members and with the other people I'm working with. So I think these are some of the things I would like to mention that really set me apart, and I'm willing to join your program and contribute further.
All right, great. So I don't want to ask you what your scores were, but if so far nobody has mentioned their score, or if they have a very good score. I think one person mentioned it. Salman probably mentioned it if I remember. So if you had good scores, mention it. High scores,
Okay.
mention it. So be positive. If you have like 5 publications, mention it.
Right.
Yeah, so mention your hard hitters. One a thing that I did not notice when you were earlier giving your answer, I think your microphone needs to be worked on a little bit. there's a little bit of an echo, or not an echo, but it seems as if you're sitting in a place which is a small room, or it's a room without it's a plain walls around you. I don't know if that's true or not.
Yes.
It's
Also,
sounding
there
like
is
that.
firework in the background. I don't know whether you are hearing. There was firework in the background.
Fireworks? No, I
don't know.
No. But
Okay, then it's
it sounded as so. Just record yourself and look at the
okay.
audio. I'm not sure
Right.
how good is my audio, but I haven't had any complaints regarding my audio recently. So the other thing, so I think you gotta work on your pronunciation. When you said VP of a society, if they could not really figure out, I think later when you said it again, I think you're saying the quiz society.
Yes.
The VP of the quiz society. So just practice your speech.
Right. Okay.
And probably will be easier if you have the video on. Then the interviewer will be looking at your mouth and will be able to make out what you are saying, right? So just practice your speech, but otherwise answer reasonable. With more practice, it'll be more fluent. I think they're good with that. So I think, so yeah, the first time around, I did not pick up that your microphone was not the best, or your surroundings. So whenever we do these sessions, you may not be in the best situation to sit, but try to be where you feel that this is your interview setup, so that you're ready. So you already have tested this out in these sessions at least. Okay, very good. All right, so I'll just take one more. I think anybody else who's left who did not respond, who did not answer. Vondi, you want to go ahead?
I'm not practicing.
Right, no, it's okay. It's okay. Maybe next time. All right, so great. All right, so next session we will be doing, when is it? I think it's tomorrow. And it's going to be a night session for the US people and morning for probably other places. When is this? I forgot, when was this? It's tomorrow sometime. Yeah, it's 10 p.m. tomorrow. And we are looking to have general conversations tomorrow. So this is going to be like a confidence session and to communicate freely. All right. All right. Sounds good. Thank you so much. And we'll catch on this, continue with this tomorrow. Thank you.
Thank you so much.
Okay. Thank you so much, Dr. Khan.
Bye-bye.
Thank you.